Bruce Willis has frontotemporal dementia, his family announces. Frontotemporal dementia, or FTD, is the most common cause of dementia for people under 60. The family of Bruce Willis announced that the actor had frontotemporal dementia, known as FTD, a form of dementia that occurs most commonly when nerves in the frontal and temporal lobes of the brain decrease in number. Mr. Willis, 67, was previously diagnosed with aphasia, which prompted him to retire from acting. FTD is a cruel disease that many of us have never heard of and can strike anyone, the family wrote in the statement. There are two main variants of FTD: primary progressive aphasia, which hampers the patient's ability to communicate, and behavioral variant frontotemporal dementia, which manifests as personality and behavioral changes. It hits the part of the brain that makes us the most human, said Bruce Miller, a professor of neurology at the University of California, San Francisco. FTD is the most common cause of dementia for people under the age of 60, said Susan Dickinson, the chief executive of the Association for Frontotemporal Degeneration. There are roughly 5,000 people in the United States with a diagnosis of FTD, she added, although many experts consider that number to be a vast undercount because of how challenging it is to diagnose. There is no blood test or single biomarker to diagnose the condition. Doctors instead identify it based on symptoms and neuroimaging. On average, it takes patients more than 3 years to get an accurate diagnosis. What are the first signs of frontotemporal dementia? People with primary progressive aphasia may struggle to speak in full sentences or have difficulty comprehending conversations. They may have a hard time writing or reading. Those with the behavioral variant of FTD may act out of character, said Ian Grant, the assistant professor of neurology at the Northwestern University Feinberg School of Medicine. Families will say that patients seem like they have lost a little bit of their filter, he said. Someone who is typically quiet and reserved may start spewing profanities, for example, or loudly commenting on a stranger's appearance. The patient may act apathetic, Dr. Millen said, losing motivation. Some may also display a lack of empathy for those around them. People with FTD often struggle with organizational skills, failing to multitask or plan. Frontotemporal dementia can also manifest in excessive gambling or impulsive spending, said Joel Salinas, a clinical assistant professor at neurology at NYU Langone Health. Dr. Grant described the poor judgment and erratic behavior that comes up with personality changes from FTD, such as drinking an entire bottle of maple syrup. They may be having instant gratification cravings without any real ability to put a check on that, he said. In some cases, patients may be diagnosed with a psychiatric condition like bipolar disorder because of these symptoms, Dr. Grant added. There are a few ways to distinguish between a psychiatric condition and FTD, though. Frontotemporal dementia typically affects people in their 50s and 60s, and it is unusual, although not impossible, he said, for people to develop a new psychiatric disorder at that age without a previous history of mental health concerns. Also, a brain scan in a person with FTD can show atrophy or shrinking in the front part of the brain, while a psychiatric illness would be less likely to show such changes. What causes frontotemporal dementia? Genetics are a critical risk factor for FTD, but beyond that, doctors aren't sure what causes the disease in most people, Dr. Miller said. There are, however, things that even people with a family history of the illness can do to lower their risk of developing dementia or to slow the disease course, he said, including exercising, engaging with others, and keeping up with cognitive activities like reading, crossword puzzles, learning a new language, or playing a musical instrument. But there isn't evidence that any one activity can prevent FTD, Dr. Dickinson said. What are the treatment options for FTD? Generally, patients with FTD will live for around 5 to 7 years, but after they first display obvious symptoms, Dr. Grant said. There is no cure, but there's a difference between a disease not having a cure and saying there's nothing we can do, he said. Occupational therapy can help patients who have difficulty communicating. Speech therapy can also be a tool to help these patients, Dr. Salinas said. Physicians often work with the families or loved ones of people with FTD to develop a care plan, which can include safeguards to make sure they cannot hurt themselves or their loved ones. Doctors may prescribe medications to help manage the symptoms. Some patients may also be prescribed antidepressants to cope with mood or behavioral symptoms, Dr. Miller said. Patients often benefit from steady, predictable routines, Ms. Dickinson said, and many patients, as well as family members, find comfort in support groups, she added. Doctors also work to ensure that families are looking out for themselves. The family often suffers as much as the patient, Dr. Miller said. Since we announced Bruce's diagnosis of aphasia in spring 2022, Bruce's condition has progressed, the Wills family noted in a statement. Unfortunately, challenges with communication are just one symptom of the disease Bruce faces. While this is painful, it is a relief to finally have a clear diagnosis. Frontotemporal dementia or FTD is a group of disorders caused by a buildup of tau and other brain cells destroying proteins in the brain's frontal lobes behind your forehead or temporal lobes behind your ears. The condition typically strikes between the ages of 45 and 65, according to Alzheimer's Research UK. The most common dementia for people under 60, FTD can cause challenges in communication as well as changes to one's behavior, personality, or movement, according to a statement from the Association for Frontotemporal Degeneration. People with FTD typically live 68 years with the condition, according to the U.S. National Institute on Aging. Between 10% and 30% of FTD cases are inherited. Other than genetics, there are no known risk factors, although researchers are investigating what role the thyroid and insulin may play part in the onset of the disease. What are the symptoms of FTD? In the beginning, it may be difficult to know exactly which type of FTD a person has or even whether it is FTD, because symptoms and the order in which they appear can vary from one person to another and depend on which parts of the frontal or temporal lobes are affected. In behavioral FTD, people rarely have issues with memory. Instead, they struggle to plan and sequence their thinking and have trouble setting priorities, according to the National Institute of Aging. They may parrot the same activity or word again and again, become disinterested in life, and act impulsively, like saying inappropriate words or doing things others might perceive as embarrassing. In primary progressive aphasia or PPA, the person might have trouble speaking or understanding words and might slur their speech. Over time, they may fail to recognize familiar faces and objects. Some may even become mute. PPA may start with difficulty simply finding words, so people begin to use simpler words or more generic words for things they can't recall, Paulson said. Now that also comes with the territory of aging, but when the language is more effortful on a daily basis or the comprehension is going downhill, that's a sign that someone should see a doctor for an evaluation, he said. Motor neuron FTD disorders may not affect memory, cognition, language, or behavior, especially at first. Initial signs may include the inability to control movements or issues with balance and walking. A hallmark sign of one of these disorders, progressive supranuclear palsy, is difficulty with looking down or other eye movements. How is FTD diagnosed? To diagnose FTD disorders, a neurologist would conduct a careful clinical examination paired with psychological testing designed to evaluate cognitive skills, Paulson said. A brain MRI can tell us if certain parts of the brain are shrinking or showing signs of atrophy. We will do some tests to make sure we're not missing some treatable causes of cognitive impairment like thyroid disease or vitamin B12 deficiency as well, he said. And oftentimes, we'll also do brain metabolism imaging, Paulson said. It's positron emission tomography or PET imaging that can tell us which parts of the frontal lobes or temporal lobes are involved.